Hello everyone, my name is Danielle Oakes. My partners Emily and Victoria and myself are students in the Speech Language Pathology Master's Program here at Kean, and we're supported by Dr. Joanne Christodoulou and Dr. James Baer. Let's begin where all of this started. One of our graduation requirements is a course run by Dr. Christodoulou that is held in our university clinic. The course is focused on the diagnostic methods and procedures used when assessing a patient for speech and language services. One of our patients had recently experienced a stroke and was seeking an evaluation, so just as we were trained, we did our research, found the appropriate testing materials, and greeted the client. Sooner than later, we learned that she also suffers from a visual impairment and had forgotten her glasses. Now, we understand why she didn't think to bring them. She was coming to us for her speech, but there is much more that goes into a comprehensive evaluation. A patient needs to see and hear adequately in order to complete testing in a way that represents their true skill level. So this got us thinking and sparked the question for individuals with hearing impairments. How are we as healthcare professionals going to accommodate individuals with a hearing loss while evaluating their speech and language? The lack of testing modifications and assessments for language disorders impact the clinician's ability to measure outcomes and optimally diagnose the client requesting or requiring an evaluation. Our primary investigation was to determine the efficacy of a PockeTalker when accommodating individuals with a hearing loss. 30 participants were tested to determine the effect on auditory accommodations for individuals with hearing impairments.
The PockeTalker is equipped with an amplifier, over-the-ear earphones, and a microphone. A continuous volume control wheel serves to adjust amplification levels, and the tone control wheel serves to adjust acoustic input from the microphone to contain a greater or lesser degree of high-frequency perceived clarity. The device is positioned next to the patient on a nearby surface, with the microphone pointing towards the conversational partner. The headphones must be placed over the listener's ears in order to hear the sound that is transmitted into the microphone. Splitting of the RIPA2 was implemented to minimize the familiarity effect and assist in revealing one or more multiple effects an accommodation may have on processing time. The comparison of processing time across all test administrations demonstrated the impact of both hearing difficulties and auditory accommodations on processing speed in a testing environment. Dependent t-tests were used to determine if the response time of participants with a hearing loss approached the average response time for participants without a hearing loss in the presence of an accommodation. Analysis of subtests 1, 5, 6, and 10 revealed a statistically significant improvement in response time in participants with a hearing loss who used a PockeTalker. Analysis of subtests 2, 3, 4, and 8 additionally demonstrated a slightly positive impact, although not enough to statistically satisfy the hypothesis. Analysis of the modified voice subtest did not reveal improvement of response time of statistical value. For future research, the following limitations were observed.
And here, we see the positive and useful impact of a PockeTalker.